Hello, Miss Smith. It's Kathleen. The nurse asked me to come in and dress you, okay? I'm going to get the clothing tops and we'll get started, okay? Want to provide for privacy? On test day, you will remember for your equipment, you need to get 2 shirts because in one of your steps, you have to ask the client which shirt they would like to put on. I always want to give them that option, okay? All right. Now, for this skill, Ms. Smith, I want to make sure that I keep you covered up at all times. It's very important to remember the critical step for this is making sure you dress the correct arm, okay? So when you're undressing a client with a weak arm, you always want to undress the strong side first and then remove the weak side. In this case, her strong side is her left side. So we're going to remove the gown first from this side. All right, let's move these up just a little bit for me. Okay, thank you. I'm going to just take this arm out. I'm going to keep your patient covered up at all times. I'm going to slide that over. Take this and slide this on. And you just relax this arm because this is her weak arm. Okay? And just move this down right up and back. You always want to make sure when you're dealing with linen, you keep it away from your uniform. Always turn it inward. And you can lay that right there at the end of your bed while you're doing your other steps. Okay? Now, again, remember, in this skill, you want to ask the patient which shirt they would like to put on. Ms. Smith, which one would you like to wear today? This one? Okay, we'll put this one in your closet. Now you're going to go over to the other side because you want to make sure that you dress the weak side first, okay? So we're going to go over here. Her right arm is her weak arm. So what we're going to do is we're going to just expose this arm for a moment. Okay? You're going to go inside your shirt like this. It's just like you're holding hands, like you're going to shake their hand, and you just slide it up their arm, okay? Now, in this skill, she's alert, so she can sit up for you. Ms. Smith, can you lean up a little bit for me? Thank you. I'm going to bring this around, okay? And you can relax. All right, now remember, her left arm is her strong arm, so she can assist you on this side here. If you would, just put your arm in your shirt here. There you go. Again, you always want to make sure you keep your patient covered up so that they're not exposed while you're dressing. Just raise up a little bit. I'm going to fix your collar. There you go. Now, when you're on test day, you can just button, if they have buttons, you can just do 1 or 2 buttons. You don't have to do all of them. But you want to make sure that they're nice and neat when you've completed the dressing process. Okay. I'm going to come back over here, make sure she's okay. I'm going to give her a call bell. Now, in this skill, of course, she has a weak right arm, so I wouldn't give her that call signal in that arm, okay? Miss Smith, here's your call signal. You just give us a call if you need us, okay? At this time, you'll be getting rid of your linen, okay? So we'll take this over to the dry linen barrel and dispose of it. Okay, we're going to place this gown in the dry linen for soil linen placement. And then at this time, you would wash your hands. And the skill is now complete. So we're going to be demonstrating how to wash this. One of the things you want to note is the equipment that you need for this skill. You're going to need a washcloth. And this is just to line the sink. You'll notice that it also says that you may use a basin, and that's just to fill up with water, and that's to do the dentures over that. But in our case, we're just going to use a simple washcloth to line the sink. It's much quicker for you. You're going to need a pair of gloves, and I have a paper towel here just for infection control. Your dentures are already here inside the cup, and then of course you're going to have toothpaste or whatever paste they have for you. This is a denture brush. Some places may not have a denture brush on test day. They may just have a regular toothbrush, and that's fine. This is for lower parts of the denture, and this end is for upper parts. But again, don't worry about the brush. As long as they have a toothbrush, you're fine. Now we're ready to start the skill. The first thing you want to do, before you do anything with those dentures, is put your gloves on. After you get your gloves on, you're going to go ahead and line your sink. Okay? Your dentures are going to be in a denture cup with a lid. The dentures, they could have uppers or lowers in there. Whatever they have in there for test day, that's what you're going to brush. They shouldn't have both, but if they do, just brush both of them. You're going to pour that water out for right now. You're going to go ahead and get your denture brush or your toothbrush, whichever one. You're going to apply some toothpaste on that. You're going to take your dentures. You're going to first rinse them off in tepid water, which means lukewarm. You never want hot water on dentures. They can cause the dentures to lose their shape, and that's not good. Dentures are expensive, and so you don't want to injure your patient's dentures. Then you're just going to brush all surfaces of the dentures. The gum areas, the teeth area, and every aspect. Doesn't matter which way you go, just make sure you cover every part of that denture. Again, that cloth is just down in there in case these slipped out of my hand, it wouldn't fall right on that hard sink and hopefully not break. So you want to be careful when you're utilizing or holding these dentures. Keep a good grip on them. Remember, you want to make sure you brush all areas. Okay. Once you've brushed all areas, you're ready to rinse them off. Make sure you rinse them off very good. Okay. Just lay them there for a moment. Rinse this out a little bit. Lay that there for a moment. You want to take your cup, rinse it out, rinse the lid. Don't forget the lid. The step says cup and lid. Remember, you can't do part of a step. You have to do the entire step. Then you want to fill that cup up to place your dentures back into nice lukewarm water. And they're ready for your patient whenever they're ready to put them in. Go ahead and rinse off that brush again. Make sure it's okay before you store it away. Get rid of this here. We're going to take this linen that was lining the sink, and we're going to take it over and dispose of it. Okay? So we'll put that in the wet. We'll go back to the sink. Once you've gotten rid of your linen, you're going to remove your gloves. Throw them away. You say to the evaluator, I will wash my hands. This skill is now complete. Hi, Renee. The nurse asked me to come in and assist you in feeding, okay? I'm going to get the tray and we'll get started. Okay? Now we get ready to demonstrate how to feed a client that can't feed themselves. One of the things you want to make sure of course, is that you get your equipment ready prior to that. And as you can see here on the table, we have a tray with some food on it. We have a cup with water and a spoon and other things. Definitely want to make sure you have that name card. And then we have a bib, or clothing protector for her, and then we have hand wipes that we're going to be using. So now I'm going to go through the steps so that you can see exactly how the skill should be performed. Okay, Renee, we're going to bring your tray around. You also want to make sure that you have a chair available because you want to make sure that you're able to sit when it's time to actually start feeding your patients. Now, one of the things you want to make sure of prior to feeding, you want to make sure that you put the patient in a 75 to 90 degree angle. One of the things that's very important is that they're in an upright position because you don't want them to aspirate while they're being fed. So I'm going to let the head of the bed up. Renee, I'm going to let your head up, okay? Now, one of the things you want to make sure, don't worry about on test day, what's 75 or what's 90 degrees. What you want to do is just let the head of the bed up all the way into a sitting position until it stops. And then you're going to know for sure that they're sitting in a 90-degree angle. Okay? Okay, we'll go no higher at this point. Are you okay? Now the bed, of course, is in its low position. You want to bring your table around, because one of the things you want to make sure of is when you're feeding a patient is that their tray is where they can see it, because they want to make sure that they can see, even though they can't feed themselves, exactly what's on their tray, because they have a right to let you know if it's something they like or don't like. Now I'm going to place a vehicle around her, or a clothing protector, I should say. Just there we go. And one of the things you want to make sure of, as we stated throughout the DVD about the befores, because again, we're order specific, so you want to make sure you do certain things prior to feeding her. One of the things it says you want to make sure of is that you pick the name card up and you actually state her name, and then you have her state her name back to you. So you are Miss Renee Smith. Would you say your name for me? All right, and she's on a regular diet. And one of the things you want to remember, when you're testing, you can't do part of the step and get credit. To do the entire skill is where you will get your credit. So you can't just say her name and not have her repeat it back to you, because you will not get credit for that step if you did that. You also want to make sure that you explain to them what they're going to have to eat prior to them eating, and then you want to ask them what would they like first. Renee, you got some cocktail here. We have a peach and a pear. What would you like first? Okay, and then we also have some water. Okay, now prior to us doing that, of course, we're going to make sure that we wipe her hands off. Now on test day, don't hand her the hand wipe and let her wipe her hands. You want to make sure that you do that, because again, it's about you feeding your patient and you're doing what you need to do. So, you wipe her hands off. And the reason we like to wipe the hands off prior to, even though we're feeding them, sometimes your patients, even though they can't feed themselves entirely, they may be able, like if you have some bread on the tray, they may be able to hold their food in a hand and be able to hold their bread or whatever. And that would be great. If they can do that, we want to allow them to do that, because we want them to remain as independent as possible with anything that they can do. Now we're going to start feeding. And what would you say? What did you want to do? Each person? And you want to make sure that you're sitting and that you're actually really making sure you're facing your patient so that you can actually see them chewing. That's very important, especially for our patients that may have dementia or some type of Alzheimer's. Sometimes they pocket food and they may not swallow because they may have difficulty swallowing and dysphagia. So you want to pay attention to that. This isn't the time you really want to ask your patients a lot of questions because they're trying to chew and swallow. So you just want to watch the process. You want to make sure prior to offering them any more food or any drink that everything has gone down fine. So, Renee, have you done? Can I see? Oh, great. Would you like some water? Okay. And make sure on test day that you give them the water. Don't give them the cup. This is sure. Again, you're just going to watch them and make sure that they're able to chew and everything okay with their eating and swallowing. Once they've gotten everything down, you want to make sure at this point you're going to be wiping their mouth and their hands again with hand wipes. As again, that's a two-part step, so you want to make sure that you do both steps in order to get credit. And we're going to take out another piece. Hand wipe and wipe your hands off. And again, remember, you're doing the skill, so don't give it to them to do it. You want to make sure that you wipe your hands off on test day. Okay, once you've done that, you've actually completed feeding your patient, so we can now get ready to remove the tray. I'm going to slide this out for a moment. I'm going to go ahead and remove her clothing protector. And we're going to come back to her, but right now, what we're going to do is we're going to be taking this over to the designated nurse supply stand where you're supposed to place your tray at this point. So now, like I said, we're going to place this here, the designated nurse supply area. I'm going to go ahead and get rid of our linens. And now we're going to go back over to the bed and in our spirit. All right, so And now we're going to go ahead and get you situated back, comfortable in bed, okay? So I'm going to let your head down. Now, in reality, when you feed someone, you wouldn't automatically let their head all the way down because you don't want them to be at risk for aspirating. But because we're testing, it's okay. So you want to make sure the bed is in its lowest position. So we're going to go ahead and lower her head down. You always want to make sure that you leave the bed in the lowest position possible to decrease the risk of falling. And then we want to make sure that we straighten her up a little. And now I'm going to make sure that her call signal is within reach. So now here's your call signal. If you need anything, you just give us a call, okay? And then at this point, you would say to the evaluator, I would wash my hands. This scale is now complete. Hello, Ms. Smith. My name is Kathleen. I'm going to be your CNA today. The nurse asked me to come in and take your radial pulse, okay? One of the things you want to remember when you're taking a radial pulse, especially for testing, you want to make sure that the arm is face up. It's very important that you have that wrist face up, and I'm going to show you what I mean by that. You want to make sure also that you're using 3 fingers. Don't put your thumb on your patient. You want to come down alongside the thumb area, just below the wrist, and you'll feel the radial pulse. For testing purposes, you're allowed to count that pulse for 1 full minute. You want to let the evaluator know when you're starting and when you're stopping. So I'm going to do that procedure at this time. I'm starting. Stop. Okay, Ms. Smith, we're all done. Here's your call signal, okay? You just give us a call if you need us, all right? One thing you want to remember is that you want to make sure that your bed is in its lowest position when you're done with your skill. Also, make sure that your patient has your call signal in case they need you. Now, at this point, you'll say, I'd wash my hands. Prior to documenting, you should always make sure your hands are washed. And also remember that when you're taking a radial pulse for an adult, that range should be anywhere between 60 to 100 beats per minute. Hello, Ms. Smith. My name is Kathleen. I'm going to be your CNA today. The nurse asked me to come in and count your respirations, okay? One of the things you want to remember when you're counting your patient's respirations is that you want to make sure that you count the entire cycle. A cycle consists of taking in a breath and exhaling. That's one cycle. Also, you want to remember that the range for that should be anywhere between 10 to 20 breaths per minute. At this point, I'm going to demonstrate exactly how we do that. Start. Stop. All right, thank you, Ms. Smith. I'm going to give you your call signal. One thing you want to remember, when you're leaving out your patient's room, you want to make sure that they have the call signal, so if they need us, they can call us. So you just give us a call if you need anything, okay? You also want to make sure that the bed is in its lowest position, and you want to wash your hands. That's very important prior to documenting. At this point, now you go and document your results. End of skill.